Auxiliary nurses, that one bone stuck in our throats that we can't seem to swallow or throw out. Nursing is a noble profession, and as Sister Florence Nightingale puts it, nursing is an art that requires exclusive devotion. Welcome to the Health Show. Remember to like, subscribe, and share this video. Now, to be a qualified nurse, you must have trained for at least 3 years and be certified by the Nursing Governing Council. In Nigeria, we have the Nursing and Midwifery Council of Nigeria, NMCN, which is responsible for assessing and licensing registered and qualified nurses and midwives. Auxiliary nurses or health assistants, on the other hand, are responsible for assisting the nurses in carrying out their duties. Unfortunately, no official body is responsible for regulating, licensing, and registering auxiliary nurses. Auxiliary nurse functions include helping the patients carry through and other manual jobs that support the nurse in caring for the patient. They can wash, dress patients, serve meals, help the patient move around and make the beds, and even monitor vital signs like temperature, weight, pulse, and respiration. Now, this function does not include giving injections, drips, stitching, or any other thing other than what was listed above. But since this is Nigeria, the auxiliary nurse has been able to escape from working within their limits to setting up their own clinics where they run without any professional guidance, even from a doctor, pharmacist, a nurse, or a midwife. And the problem, however, begins with their training. There is no set requirement or guideline to be an auxiliary nurse or a health assistant. Anyone can get up and want to become an auxiliary nurse. Now, this is not just a Nigeria problem. It is also the same in the UK. In the UK, there are no set requirements to be employed as a health assistant, also known as auxiliary nurse. They need you to just know how to communicate properly. In fact, the NHS website in particular clearly states that there are no requirements to becoming a health assistant. Now, employers expect good literacy, and many ask for GCSEs or its equivalent in English and Maths. They may or may not ask for a healthcare qualification, such as BTech, NVQ, or whatever it means. It is too vague, just too vague. Because of this, several health establishments have cashed in on this to set their training standards for health assistants. We will begin with community pharmacists. Some pharmacists will have self-staff, known as trainees, who will pay a token and then learn how to administer drugs in their respective doses. Now, depending on the amount agreed, the trainee may spend between 3 to 18 months learning this pharmacy skill. I know many of us may not think it is bad, but it is the irony of the whole situation for me. I am sure when you come into the pharmacy, they are like, pharmacist, I understand you went to school for 6 years, but please take this 100K and let me learn some of the important things you learned in school, so that by the time I am done, I can set up a chemist close by and be a competition. Now, does it make sense? Now, apart from all of that, there's a lot of damage that the whole process can do. Now, these persons may not be guided properly on the boundaries of dispensing and may go ahead to administer highly controlled medications, which can lead to death or paralysis. Now, a research published in 2018 pegged the number of community pharmacists in Nigeria to be about 4,000. Now, imagine those pharmacists churn out at least one training yearly. That is even more than the number of pharmacists graduating from pharmacy universities each year. Now to hospitals. Just the same way for the pharmacists, hospitals accept these persons to pay some, usually higher than the sum paid in the pharmacy, of course. They then admit these persons to learn the ropes of administering care. And these include all levels of care. They get posted to different wards, they run shift, they stitch, and sometimes they are taken to the theater. Now, it is estimated that 80% of private hospital staff are trainees aiming to become hospital nurses. Now, these persons are usually given certificates and they throw lavish parties to celebrate their graduation. Black David, Fergo, Maxwell, and I combined may not be able to throw such parties. Now, there are several cases of this training creating treatment plan where the doctor is absent, and many times the doctors send them out to give private care to hospital patients. Now, all of this happen because there are no set rules or laws or regulations that are aimed to license these hospital trainees. And the truth is that nature does not allow for a vacuum. The hospital and pharmacists have put it upon themselves to run this kind of training, giving them access to controlled products and services. Now, I know some of you watching this may have experienced or heard about 1 or 2 episodes where a health assistant or auxiliary nurse make a gross mistake that could have been fatal. A popular one is Mobad. You remember Mobad? An auxiliary nurse was reported to have administered an injection to him, which is way beyond their scope of service. She had injected Mohbad with 3 different drugs. Shortly after, he began vomiting and convulsing. Mohbad was then rushed to a hospital where he died. His body was buried the following day. Now, funny enough, the police also arrested the person who called the auxiliary nurse simply because he invited an unqualified nurse to treat Mohbad in a non-clinical setting. Now, both of them may not have had any ulterior intention, but they had no license to cover their action. Also, she would not have had the bonus if she was constantly reminded in the hospital where she trained never to give injections. Now, having said all of this, it is important to stress that auxiliary nurses have also been helpful in critical conditions. Now, they have helped save life in case of emergency, but that is it. Only on emergency cases should you allow an unprofessional to provide care. Now, I listed their functions earlier, and that's it. It doesn't go beyond that. Auxiliary nurses are good in emergencies. Rural areas, hinterlands, in Igara, where like the closest hospital is like in the middle of the Salt Lake, filled with crocodiles, fine, they are needed there. Now, they are like two sides of a coin. Now, having said all of this, it is important to stress that auxiliary nurses have also been helpful in critical conditions. They have helped save life in cases of emergency, but that is it. Only on emergency cases should you allow a non-professional to provide health care for you. Now, I listed their functions earlier, and that is it. It does not go beyond that. Auxiliary nurses are good in emergencies, rural areas, and hinterlands like Igara, where Black David is from, where their closest hospital is in the middle of a Salt Lake filled with crocodiles. Now, they're like two sides of a coin, you understand? The other side is damning and dreadful, while one side is good. Now, they have helped save countless of lives by their basic medical knowledge. And for those who don't know where to stop, they have helped cause loss and damage to life. Now, one way to improve the situation is that healthcare assistants should be taught how to self-regulate themselves. They are preventable deaths if only the auxiliary nurses had known when to refer to a hospital for proper management. Auxiliary nurses are also replete with weird drug combinations to help enforce a fatality or cure an ailment. Now, these combinations have led to quick deaths and severe side effects for users. For example, they are known to mix several combinations like pawpaw leaf, bitter cola to induce abortion, which is very strange. And usually, I don't really know where they get those ideas from. Now, the way forward, the Nursing Council, the Pharmacy Council, and the Medical and Dental Council should enforce compliance within their professionals. That way, everyone desist from being impostors, as this will help protect the medical space. Secondly, these councils can form guidelines and routes to train and register health assistants. But in reality, the Nursing Council should have the sole right to register and license health assistants and auxiliary nurses. To everyone watching this, whenever you are receiving care, especially in a pharmacy and a private hospital, ensure to query the qualification of anyone attending to you. Now, in a pharmacy, ask for the pharmacist. While in a hospital, ask for the doctor or ask for a registered nurse. It is your right. Know it. Now, I understand many auxiliary nurses may be watching this. Don't feel discouraged. Don't feel depressed or sad. The truth is this. Whatever training you have received, you have to self-regulate yourself so that you are able to protect yourself and protect the life of everyone you are attending to. Now, as soon as you realize that this person would need care, maybe by administering of drugs or administering of any treatment plan, you kindly refer to a hospital, and that's the way out, and that is the best practice to do. Thank you very much for watching this show. I appreciate your time. Remember to like, subscribe, and share. Bye for now. Have you ever been given drugs in the hospital and you notice that the drugs are either repackaged or the name scratched off? Well, welcome to Nigeria's private hospitals. This is a health show, your number one health content creator. Now, in Nigeria, private hospitals are much more accessible form of healthcare. Now, much more than the government owned. They can be found on almost every turn in some urban areas. Now, what they do is they replace the persistently low quality and inadequate health services provided in some public facilities, not public health facilities. Now, if we are to compare data, patients at some private hospitals are more likely to survive than those at public hospitals because the staff at the private facilities tend to put in their best because of the immediate repercussions of not doing so. However, this is not always the case, since some of these private hospitals need to be managed properly or totally wiped off the surface of the earth. Now, in some cases, private hospitals are death traps, and they can be the shortest route between any sickness and death, even headache. Now, sometimes and many times, doctors who own these private hospitals are also employed as consultants elsewhere and would actually not be around themselves or have any doctor on ground in their hospitals. Now, they train quack nurses in this hospital who sometimes replace and do the work of licensed nurses, doctors, and pharmacists, and can be a health risk to many patients who work in. In another video, we talked about quack nurses and how privately owned hospitals are the machine that churn them into the society. Now, another problem with private hospital is that they can be costly. Now, this is quite understandable given that the current economy situation is not friendly. All right. However, this leads us to the main public health problem caused by private owned hospital, which is repacking drug items. One popular trend the private hospital engage in keeping their patients committed is peel off the labels or picking the drugs out of their original sachets and placing them in a new unlabeled envelope for the patient. Now, in their defense, they have two reasons for this. Listen. First, they say they are trying to prevent the patient from self-medicating. Now, this is ludicrous. You do not say because you do not want your child to have bad friends, then you blindfold them as they walk the street. We all know the best thing to do is to cut off their eyes, but that's not the point. Now, the point is that is a very ridiculous excuse to say in order to prevent self-medication. Now, the other reason they give for repacking drugs, some of these medicines are popular and have identifiable packages. Now, these patients have an idea of the cost of this medicine. It can hinder them from placing extra charges on these drugs for them to be able to break even. This also does not even make sense. All right, the last time I checked, doctors are professionals. You can also attach a professional fee to your service, and patients will gladly pay you as soon as you meet your professional responsibility. For example, some hospitals are costly, but you still find patients going there because they get the satisfaction that they need. This is different from some private owned hospitals. They don't want to provide professional care, but they also want to jack up their price. You can't get both sides. Repacking medicine is criminal and can put the patient in danger. One of the rights of being a patient is knowing the name of the medication you are on and also be able to identify them in case of an emergency. That is a right. Now, in a few weeks, this show, we are going to analyze the rights of the patient and all the things you need to know before walking to a hospital and a pharmacy. Now, but to mitigate this evil trend, there should be proper regulation of private hospitals, especially in the rural areas. Now, rural areas are the places where these sharp practices occur most. Now, the reason for this is because they have little or no chance of proper regulation. Now, another solution is partnership. Because of the cost of running a pharmacy, private hospitals may have to partner with community pharmacists to open branches in their hospital, and this can encourage better drug handling, cheaper, and also increase the availability of drugs. Now, for those who cannot afford to access healthcare in private hospitals due to the high cost, you can get a health insurance. Now, health insurance is a type of insurance that covers the whole or part of the risk a person incurs, such as medical bills or expenses. Now, in simpler terms, it's an agreement in which an insurance company agrees to pay for some or all of your medical expenses in exchange for a monthly or yearly premium. In another video, we'll discuss the different health insurances, policies, and how you can get on board. For now, ensure you know the name of the drug you get in the hospital whenever you get there. Ask about the name, ask how it is taken, and when to stop. You can also ask about the name of your doctor for easy referencing, either for good or for bad. Thank you for staying tuned to the end. Before you go, you can share your private hospital experience in the comment section. Let us know if you're satisfied visiting any pharmacy or a hospital. Remember to like, share, and subscribe to this channel. Bye bye. See you.